Hi everybody, just a few quick updates that I wanted to let you know about. The first one is a change to our shift huddle process that's going into effect on Thursday morning at 6:45. So please be aware, we now are going to have shift huddle in one location only. That means everybody, whether you're working ICU A or B, is going to show up in this one location, and that is in ICU B across from where our secretaries are sitting lately, and that is in front of the visitor elevators. So one location for shift huddle, ICU B at 6:45 a.m. or p.m., and that is where you will receive your assignment as well for the next shift. Please make sure that you're on time. It's important that you're kind of just ready to go for work after that. So if you do choose that you want to wear the hospital scrubs, which I know that they are not always available lately, but if you are changing into hospital scrubs, please make sure that you're changed already and ready to go at 6:45 and waiting outside of the visitor elevators by the secretary desk at 6:45. That is also where you can get your rover phone for the next shift. You'll get your assignment for the next shift, and of course your shift huddle, anything, any important information there. So please be ready for that. 6:45 will never be more than 5 minutes, so you will not be late going out onto the floor. But there is that important change. Please be aware of. Speaking of scrubs, just a reminder, you should not be wearing scrubs home from the hospital. The whole intention, hospital scrubs home. The whole intention of the hospital scrubs is to prevent you from bringing home anything that you may have picked up on your clothing. And the reason that they are not always available now is because they're missing. A lot of them are going, we know that some of them are going home with people, so please make sure that you're not doing that. You should not be wearing hospital scrubs home from the hospital. And then also, if you did bring some home, just bring them back. It's okay. You won't be in trouble for it. We are using a lot of oxygen in the hospital. This is another issue that has come up, and it is significantly more than we've ever used before. And as a result, some of our equipment is having kind of some issues with it. So, of course, we're just going to keep using oxygen as much as we need to. It just is what it is. It's like the treatment for COVID. But please don't leave oxygen on when you don't need it. So, occasionally you walk into a room where the patient has maybe gone off for a procedure, and you'll see that the oxygen is running full blast, something like that. I know that's not happening a lot, and it's not what is causing the issues that we have with oxygen usage in the hospital. However, please just be mindful that oxygen at this level, where we're using it on so many patients at such a high amount, is causing some issues for the hospital, and so we don't want to be wasting any of it. It's not the fact that we're wasting the oxygen, it's the flow of oxygen through the organization that's the issue. So please don't leave oxygen on when you don't need it. We have a stroke survey coming up at the end of this week, so I just want to bring everybody's attention. Alicia mainly, but I will also be reaching out sometimes to kind of talk about our stroke measures and kind of get us ready. But when we have stroke patients coming in, we want to make sure that we are documenting everything the way that we're supposed to be documenting it. If you have any questions about it, please ask your charge nurse. Refer to our stroke guidelines for neuro checks and NIH and all that kind of stuff. If you have any questions, please just ask, but we want to just be sure that we're doing a very thorough job on documenting, since we have that stroke survey coming up. We do a great job taking care of stroke patients, so we just want to make sure that we have our I's dotted and our T's crossed for when the surveyor comes in and actually looks through the chart. And then finally, the last thing I wanted to let you know about is you will notice that downstairs where the Amon G. Carter Cardiovascular Center waiting room is, is now going to be our Fastrack ER. And that is just an extension of the ER because of how many patients are coming through. Those are low acuity patients, but be aware that's an ER waiting room out there now. So some of those patients are coming in with symptoms. That's it, just to be aware of it. That's all, in case you're wondering why suddenly there's a lot more people sitting out there. That's what's happening. It's one of the measures that our administration has taken to be able to alleviate some of the pressure from our ER with all of the extra patients coming through. That's all that I have. You guys have a wonderful evening.